Hi, my name is Alyssa Skolsky, and my PowerPoint presentation is on mental illness. What is mental illness? Mental illness are health conditions involving changes in emotion, thinking, or behavior, or any combination of these. Mental illnesses are associated with distress and problems functioning in social, work, or family activities. Nearly 1 in 5 U.S. adults experience some form of mental illness. 1 in 24 have serious mental illnesses, and 1 in 12 has a diagnosable substance use disorder. More about mental health. Mental health is the foundation for emotions, thinking, communication, learning, resilience, and self esteem. Mental health is a key relationship and personal emotion well being and contributing to community or society. Mental illness can affect anyone regardless of age, gender, race, ethnicity, and etc. While mental illnesses can occur at any age, three-fourths of all mental illnesses begin at the age of 24. Mental illnesses come in many forms. Some are mild and only interfere in limited ways with daily life, and other mental illnesses are very severe. Diagnosis. Mental health conditions are treatable and improvement is possible. Many people with mental illnesses return to full functioning. Some mental illnesses are preventable. It is not always clear when a problem with mood or thinking has become serious enough for it to become a mental health concern. For example, a depressed mood is normal, such as when a person experiences the loss of a loved one, but if that depressed mood continues to cause distress, then that person may benefit from professional care. Some mental illnesses can be related to or mimic a medical condition. For example, depressive symptoms can relate to a thyroid condition or any injury. Stigma around mental illnesses and treatment prevents many people from seeking needed treatment. Treatment with mental illness. Mental illness treatment is based upon an individualized plan developed collaboratively with a mental health clinician and an individual. It may include psychotherapy, medication, or any other treatments. Often a combination of therapy and medication is most effective. Self-help and support can be very important to individuals' coping, recovery, and well-being. Lifestyle changes such as nutrition and exercise can support mental health recovery. There's 5 stages of mental illnesses. The first one is acceptance. The second one is insight. The third one is action. The fourth is self-esteem. The fifth is healing. And then the sixth is meaning. The effect of mental illnesses with exercise. Exercise can improve mood and reduce symptoms of mental illness, including depression and anxiety. Exercise can improve sleep quality, increase energy levels, and reduce stress. Research shows that people who exercise regularly have better mental health and emotional well-being and lower rates of mental illnesses. Experts recommend adults should be active most days, aiming for a total of 2.5 to 5 hours of moderate physical activity per week. So for the case study, it's a patient. His name is Rob. He's 33-year-old male who reports experiencing depressed mood after loss of a close relative 6 months ago. Rob described his feelings as overwhelmed and emptiness. Rob reports chronic difficulty managing his strong emotions and recognizes that others would describe him as moody. He also tore his ACL playing basketball when he was 22 years old, and his knee has never been the same. And since then, he's also been like up and down depressed about it. He expressed that he has tried to exercise to boost his mood, but he doesn't know where to start at the gym, and he feels like he does not fit in. He wants to become a better version of himself and just feel overall better. So for exercise testing, I said that he would be clear to exercise and just to have the informed consent should be completed before giving an exercise prescription. And then the CV risk factor analysis for his knee just in case there's something off with it. For the exercise prescription, have Rob start off with a walk or a light jog about 10 to 20 minutes. Did 4 to 3 sets of 10 squats with 10 to 15 pound dumbbells, or if he's comfortable to use a heavier weight, he can. 3 sets of 10 forward lunges with also weight if he wants to add it, if he feels comfortable. 3 sets of 10 box step-ups, 5 steps on each leg, 3 sets of 10 lateral pull-downs, 3 sets of 10 bicep curls for weight, start at 15 pounds and build up, 3 sets of as many until failure pull-ups with resistant band for help. 3 sets of 10 push-ups, can use his knees if needed. And then at the end, a light walk for 10 minutes. And also like stretching and stuff like that. So in conclusion, it is important for someone struggling with mental illness to exercise so they can feel better about themselves. Someone struggling from a mental illness can still do any type of exercise. And I hope you guys know how to manage a prescribe an exercise prescription for someone with a mental illness. And then here are my references.